NORETHINDRONE.
So to formally introduce ourselves, we are the drug norethindrone. We also go by the name norethindrone, so that's pretty much the same. So that's for our generic name. But for our brand names, we have a lot of different names in different countries. So I'm gonna let you know some. So we can be Micropill, Micropill Plus, Minipill, Julivet, iJustine, Camilla, Nora BE, Erin, and my most favorite name, Heather. But like any other drug names, we also have a complicated name, meaning that's our chemical name. For our chemical name, it's C20H26O2. And this is the exact molecular formula of norethindrone. So let's go to the next basic information. So for the drugs, they are classified according to their therapeutic effect and pharmacologic effect. So for our therapeutic effect, we belong to the contraceptives. So we are used for contraception to prevent women from getting pregnant. And for our pharmacologic effect, we are the progestins. We belong to the group of progestins, which I'm going to explain to you further in our mechanism of action. So next, for our pregnancy category, we belong to category X, which unfortunately we show or demonstrate fetal abnormalities and adverse reactions, which the studies have indicated evidences of fetal risk. So if you're pregnant and you take us in, so the risks are way greater than the possible benefits it will provide. So if you don't want to get pregnant and you want to use contraceptives, please consult your doctor first. Let's get into the mechanism of action. So how do we really work in the body? What is our job? Okay. So progestins like us primarily exert our effort on target cells by binding to the progesterone receptors to produce our action. So when we bind to these progesterone receptors, that's when we do what we do. So by the way, target cells are mainly found in the reproductive tract, breast, pituitary, hypothalamus, skeletal tissues, and the central nervous system. Okay, so our job is to inhibit the release or the production of follicle-stimulating hormone (FSH) and luteinizing hormone (LH) from the anterior pituitary. So by releasing these hormones, by stopping the release of these hormones, we are able to prevent follicle development, meaning there will be no ovulation or pregnancy. So that's why we are used for contraception. So aside from us being used for contraceptions, we can also treat various conditions like primary and secondary amenorrhea, abnormal uterine bleeding, and other hormone-related conditions like menopausal symptoms and endometriosis. So as much as we can treat various conditions, we can also induce changes in the body like endometrial atrophy, irregular secretion, and suppressed proliferation, which makes it unavailable for implantation, so mainly for contraception. Okay. For additional information, in menopausal women, we are also used as a component for hormone replacement therapy because again, we inhibit or suppress endometrial growth. Now, as we recall, in postmenopausal women, the estrogen stimulates the growth of the endometrium. However, in postmenopausal women with an intact uterus, the estrogen without the addition of progestins can lead to endometrial hypoplasia, and if left untreated, it can risk the development of endometrial cancer or cancer in the uterus. Endometrial hypoplasia, by the way, meaning the endometrial lining in the uterus is very thick, which becomes detrimental if not managed properly or if left untreated. So that's it for the mechanism of action of our drug norethindrone. So one is for contraception, and two, it's for treating various conditions, specifically hormone-related conditions. Allow me to discuss the pharmacokinetics. So how does the body deal with us? How does the body react when we are taking it? Okay, so for the pharmacokinetics, we have absorption, distribution, metabolism, and excretion. So for absorption, we are well absorbed via oral administration. And then we are distributed into the bile and breast milk of the lactating mothers, and we are about 80% protein bound. For metabolism, we are primarily metabolized in the liver, where we undergo an extensive first pass metabolism. And for excretion, we are mainly excreted via feces. So elimination half-life is 5 to 14 hours. So that's it for our pharmacokinetics. So again, absorption via oral administration, distribution into the bile and breast milk, metabolism in the liver, and excretion via feces. So I hope that you were able to catch up and learn the first part of our introduction. Now, to know more about us, let's go and listen to my partner, another NORETHINDRONE, to express and introduce more facts about us.
Hi guys! So, I am going to talk about the indications, contraindications, side and adverse effects of norethindrone. I am also going to talk about the nursing responsibilities in administering norethindrone. But let's go first with the indication. Norethindrone or norethisterone, when given as a monotherapy or in combination with an estrogen component, is indicated as an oral contraceptive. Together with an estrogen component, it is also indicated as a hormone replacement therapy in the treatment of postmenopausal osteoporosis and moderate to severe vasomotor symptoms which arise from menopause. Norethindrone or norethisterone is also indicated in menorrhagia, endometriosis, dysfunctional uterine bleeding, premenstrual syndrome, postponement of menstruation, dysmenorrhea, and metropathia. Norethindrone or norethisterone is contraindicated to the following. First is pregnancy. It may cause fetal harm when administered to a pregnant woman. It is also contraindicated to patients with undiagnosed abnormal vaginal bleeding or patients with suspected or history of breast cancer. It is contraindicated to patients with recent or active arterial thromboembolic diseases such as stroke and myocardial infarction. Moreover, norethindrone or norethisterone is contraindicated to patients with liver dysfunction or liver diseases, hypertension, autoimmune diseases, kidney diseases, and hypersensitivity to any of the components of the drug. Norethindrone or norethisterone must be used cautiously to the patients with the following condition: diabetes mellitus, migraine, seizure, cardiac diseases, and asthma. Now let's go to the side and adverse effects of norethindrone per body system. Let's start with the nervous system. So norethindrone causes dizziness, headache, drowsiness, somnolence, concentration loss, migraine, tremor, cerebral thrombosis, and embolism. In the cardiovascular system, norethindrone causes thromboembolic disorder, thrombophlebitis, increased blood pressure, edema, and increased counts in white blood cells and platelets. In the digestive system, norethindrone may cause gastrointestinal disturbances, abdominal pain, vomiting, nausea, and bloating. In the integumentary system, norethindrone may cause skin disorders, acne, hirsutism, alopecia in some cases, rashes, melasma, urticaria, and even exacerbation of existing skin conditions. In the reproductive system, the use of norethindrone may cause the following: vaginal or uterine bleeding, short-lasting amenorrhea, and breast discomfort. In the respiratory system, the use of norethindrone may also cause the following: respiratory distress, paroxysmal cough, dyspnea, and pulmonary embolism. So as for the special senses, it affects specifically the eyes. So, the use of norethindrone may cause diabetic cataract, vision disorders and disturbances, contact lens intolerance, and optic neuritis. So aside from all the effects I have mentioned per body system, the use of norethindrone also may increase your weight, exacerbation of diabetes mellitus, fluid retention, and increase serum in potassium and calcium levels. It may also cause clinical depression in some cases, nervousness, and insomnia. Other than this, it may also cause cholestatic jaundice, fever, fatigue, and pain in the extremities. So those are all the possible side and adverse effects in using norethindrone. Now let's move on to the nursing responsibilities before, during, and after administering or giving norethindrone to the patient. So before the nurse administer or give norethindrone to the patient, the nurse must first assess if the patient has any of the mentioned contraindications in order to prevent further complication. The nurse must also explain to the patient the possible side and adverse effects of norethindrone before the patient takes the first dose. Encourage the patient to read the insert package carefully. Tell the patient to take the medication regularly every day if it is used as an oral contraceptive. Explain that the risk of pregnancy increases with each tablet missed. If she misses one tablet, tell her to take it as soon as she remembers it and then take the next dose and the regular time. Teach the patient how to perform breast self-examination. Encourage the patient to avoid high dose of vitamin C, folate or pyridoxine, and to limit the intake of caffeine. So during administration or giving norethindrone to the patient, the nurse must ensure that the right drug is given to the right patient. The nurse must monitor the patient for possible development of breast tumors, cardiac disorders, and hypertension. Encourage the patient to report any occurrence of visual disturbances or migraine in order to stop the administration of the drug. Provide comfort measures to help the patient tolerate the side effects of the drug. The nurse must also encourage and remind the patient to limit the intake of caffeine and to avoid smoking. So after administering or giving norethindrone to the patient, the nurse must encourage the patient or the client for compliance with the follow-up treatment. Evaluate the effectiveness of the drug and the client or the patient's response to the therapy. Encourage the patient to report any signs and symptoms of the possible adverse effect of the drug. Lastly, evaluate the patient's level of knowledge in terms of the indication of the drug, how to use the drug, its contraindications, and its adverse effects. So guys, those are all the necessary things that you must know and learn about the drug norethindrone. So guys, we hope that you have learned something after watching this video and that you will be able to apply all those learnings in the future as you become a nurse. Thank you for watching and God bless!